So what I was presenting today is a looking forward abstract. So it's for a study that I'm embarking on early this year. And it's called Perseverance with Practice, the Perspective of Stroke Survivors in Northern Queensland. So I would like to respectfully acknowledge the Kalkadoon people, who are the traditional owners of this land on which we stand today, and the elders both past and present. And I would like to do my acknowledgements first because I feel like it's that slide that's always skipped over right at the end. So in terms of funding, I've been lucky enough to get a CERTA grant from Queensland Health for this project coming up. The NAHSSS postgraduate scholarship has also helped with the last year of my studies. The Florey Institute of Neuroscience and Mental Health, who provide in-kind support, and James Cook University, who provide me with an RTP scholarship, and the Colleges of Healthcare Sciences and Engineering and Mount Isa Centre for Rural and Remote Health, recently renamed Centre for Rural and Remote Health. I would also like to acknowledge my supervisors, so Associate Professor Ruth Barker, Dr. Catherine Haywood, Dr. Paul Chapman, who's our rehabilitation consultant at the Townsville Hospital, and Professor Wei Zhang. So a little bit about me. This is why I asked Sean not to do a really long introduction because it's on my slides. I was North Queensland born and raised, so I lived in Tully for the first 17 years of my life. Tully is a very small rural town. It's got about 5,000 people, roughly, and I grew to love it. I completed my Bachelor of Physiotherapy with honours in Townsville, so I moved straight from Tully to Townsville and I kind of stayed there ever since. Since graduating, I've been a neurorehabilitation physiotherapist at the Townsville Hospital. So I started out just rotating through the services and getting a feel for what I liked most, and found that that was neuro rehab. So I like strokes, I like brain injuries, and I really like amputees. So following this, about 2 years ago, Ruth said to me, "Bridie, do you want to do a PhD?" And I thought, no. Laughed at her and walked away. And she sent me an email and she said, "I was really serious about that, can we have a meeting?" So I said, "Oh, well, okay. If you think that I can do it, then that's something I'd probably be interested in, because there's some big questions that I want some answers to." So through my PhD, what I'm investigating is that perseverance with stroke survivors and their ability to practice in the home. So I just wanted to tell you a little bit of a story about Ronnie, to give you a little bit of context. Ronnie's a 66-year-old man. He lives in Tully, and he's about 6 months post-stroke. He's a fourth generation cane farmer. So in the slack season, he farms the land, he does the machinery maintenance, he keeps going, he gets all his workers moving, and he generally just keeps an eye on his farm and starts growing that cane. In the season, he's a harvester driver, so he's working 16-hour days trying to get the cane off. He's got a big business, he's got 8 farmers, and hundreds of thousands of tonne of cane to cut. Once Ronnie had his stroke though, he wasn't able to return to that sort of work. So he's got an upper limb impairment. He did his inpatient rehabilitation in Cairns. Cairns is 200 kilometres away from Tully. So he's displaced from his family to begin with. Then he goes to outpatient rehabilitation. He goes once per week. That's a 400-kilometre round trip. So him and his significant other, they get in their car, off they go. For a 1-hour appointment, they spend 5 hours in travel. Ronnie has difficulty completing his home program with his arm. He feels like in that 1 hour he doesn't really get enough information from his therapist about what he's actually got to do. And then he feels like he doesn't really have enough movement to work with. So he's really struggling at home trying to do that program alone. And he's got a decreased quality of life. He's spending a lot of time in the car. He's feeling really fatigued. And he can't return to the work that he used to do. So this means in the long run that Ronnie loses his farm. And that's huge, I think, for people in rural and remote areas. So this is why I'm talking about North Queensland. As you can tell, I love North Queensland. It's huge, and it's got a massively diverse multicultural population. So we've got lots of Aboriginal and Torres Strait Islander peoples. We've got lots of immigrations, and that creates a really difficult environment to provide healthcare services in, especially for stroke. But more importantly, people have those really physically demanding jobs and lifestyles, and they're really trying to get back into that work, and it can be really hard for them if they have an upper limb impairment. So inpatient rehabilitation is mostly provided in Cairns and Townsville hospitals in North Queensland. We really like to focus on early discharge. We like getting people out. Rehab's focused on safe mobility because walking safely or in a wheelchair safely gets you out of hospital. And that's important for the healthcare system because it decreases the money. And most stroke survivors then become really dissatisfied with their upper limb recovery, and their lack of functional recovery sort of limits that return to the NQ lifestyles and work. So similarly to Ronnie, there's people out there in those situations that can't actually return to their life and their hobbies. So then we've got some outpatient rehabilitation. We've got a few centres for outpatient rehabilitation. We've got Cairns, Townsville and Mount Isa. So we've got a couple more. And outpatient rehabilitation is really about getting that intensive, repetitive and task-orientated practice to help people get better and exploit all their recovery potential. But there's that lack of services in rural and remote areas. So again, people have to travel. And there's a huge cost to undergo rehabilitation. It's not just the travel cost, but it's the personal cost. People are being away from their country, away from their home, away from their loved ones and their support networks. So what is the solution? I think it's home-based rehabilitation to an extent. And I think technology can help. So people are familiar with technology in North Queensland. We have lots of use of technology in North Queensland industry. So as you can see, we've got GPS farming technology, we've got sonar technology for fishing, you know. People are pretty happy about that, you can see the fish. But technology that's been implemented in the past has really high abandonment rates and poor adaptability. People have a fear of technology. And they're really urbanised programs. They get set up in places like Brisbane and they provide games to people and people go, well, this doesn't interest me. This has got nothing to do with fishing or hunting. So I think we need to design with stroke survivors and not just for them. And I think that's really important. So I'm doing a literature review at the moment, and these are more preliminary factors. So perseverance we find is influenced by 5 factors. Meaningful improvement is the first one, so people really need to have those goals and they need to acknowledge when they're attained. And they have to have the ability to complete activities of daily living as a result of completing their practice. It needs to be really acceptable, so people aren't going to use something that looks ugly in their home or that they think risks their children getting hurt by it. People aren't going to use it if it's really, really big and cumbersome and takes up, 3 metres of space in their living room. They need to be able to use it. Stroke survivors must be able to set themselves up independently because if they're relying on someone, it makes it really hard for them to practice, yeah? They need to know how to fix it when it breaks or have support to fix it when it breaks. And they need to be able to progress that independently. They need to be engaged. So practice needs to challenge them because if it doesn't challenge them, they're going to go, oh, why bother? They need to have choice and variability. Who wants to do the same thing? We're talking about thousands upon thousands of reps. People cannot do the same thing over and over and over again. It becomes boring. It's about competition. So can they compete against themselves? Can they compete against others? And does it allow some social inclusion? So a lot of patients become quite isolated and they need that social inclusion to continue and to be motivated. And then it's about accountability. Who do they feed back to? Because I know right now, if I'm not accountable to somebody when I do my exercise every day, probably not going to do it. So what are the aims and objectives of my study? We want to explore what stroke survivors' perspectives are on perseverance with independent practice to promote upper limb recovery. We want to understand what perseverance with independent practice means to stroke survivors in North Queensland. We want to explore and describe the factors that relate to perseverance with home-based rehabilitation. And we want to explore and describe the attitudes that stroke survivors in Northern Queensland have with regards to utilising technology for their rehabilitation needs and their potential to increase perseverance with practice using technology. So I'm planning to do a qualitative study. It's got somewhere between 12 and 20 in-depth interviews, I think, with the potential to expand that if I'm still finding new things at 20 interviews. Hopefully not, because I'm not sure my funding extends that far. We're looking at stroke survivors who are residing in Northern Queensland, and I want to conduct it in the patient's or the participant's home, or a place of their choosing. So it's similar to what Lenore said yesterday about us really going to them, rather than expecting them to come to us. Also, it gives me a lot better of an idea of what does their home look like and how can I implement something into these homes, because it's not the same everywhere. And we're looking for purposive sampling for maximum variation, so age, gender, Aboriginal and Torres Strait Islander status, severity of impairment, those sorts of things. So They must be adult stroke survivors. They need to be people that have had a stroke about 3 months beforehand. They must have a persistent and self-reported upper limb disability, and they need to have or be able to communicate or have a significant other that can communicate on their behalf. 2 minutes. So I'm recruiting through JCU and HHS media releases, word of mouth and personal networks, and the interviews are going to be voice recorded and transcribed after that, and then put it into in vivo and analysed using principles of constructivist grounded theory. So my time frame started in June and goes to June 2018 and goes to June 2019. The most important part about this slide is the fact that data collection and data analysis are the same time periods, and that's because we're going to reanalyse our interviews as we go to find out more, because we want to know as much as possible. So the expected outcomes are that we understand what perseverance means to stroke survivors in northern Queensland and the factors that influence the perseverance for them specifically. We want to understand the attitudes of them with regards to utilising technology for their rehabilitation needs and how they perceive that that will impact on their ability to persevere. For the health system, it'll mean decreased healthcare costs and decreased demands for centre-based rehabilitation. Also, it'll increase access to centre-based rehabilitation for other patients that require it. For the therapists, it means they'll be able to support and create feasible and effective home-based rehab programs because we'll know a lot more about what stroke survivors actually need and want. And for the patients themselves, it should decrease their secondary impairment and wait times, and also their cost, personal and monetary, that's associated with that travel for centre-based rehab. And it increases their independence with home-based rehab, recovery and quality of life. What am I going to do with this information? I want to design novel technology, co-design novel technology with stroke survivors that's designed for northern Queensland, where there's minimal services to support implementation, practice, progression and perseverance, and to pilot the devices in the homes of stroke survivors in northern Queensland. Hopefully, technology implemented into people's homes will help improve service access for those living in rural and remote areas. Thank you.